Okay, so we'll go through first aid, or simply put, basic first aid that all of us will need to understand. And in the few remaining minutes, or in the few minutes that we have together, we will go through this important discussion. And one would ask, why are we learning about first aid? First aid becomes important because we are also going to be placed in a situation where we may not have the opportunity to have the basic necessities to provide care to our clients. So first aid becomes something that we need to learn and understand. And all in all, it will be this lesson will place you in a position to use available human and material resources at the site of an accident or an emergency. Now, there are several definitions of first aid. One could define first aid as the first care that you will be able to give to a client who is at the center of this emergency before facilitating their movement to go to an institution where they are able to get care that is in a more organized manner. So we are providing first aid to clients or casualties or patients before the ideal setup comes in. On your screen, it says these are measures that need to be taken immediately after an accident, not with an idea to cure. So the issue of being therapeutic is not arising, but you want to stabilize even as this patient is taken to an established institution. What could be the objectives of first aid? Why are you doing this aid, which we are terming to be the first or the initial? Number one, you want to preserve life. Secondly, you want to prevent the victim's condition from worsening. And thirdly, you want to promote recovery. So these become so critical. Preservation of life, preventing the condition from worsening, and also promoting recovery. Now, besides this, the scope of first aid or the parameters in which first aid is being practiced, it's let me just okay. So the parameters in which this first aid is being offered, or the boundaries of you offering first aid, number one, yes, you would be able to diagnose or make a diagnosis, but you will be limited in terms of giving aid to this patient. So treatment can only be given at a point where we have skilled attendants, yourselves, or doctors take care of this patient, then that treatment could be instituted. However, you are not able to treat the patient at the site of injury. Now, besides this, it's very important that you do the initial assessment. I would give you an example of myself. There was a time we were walking into a big shopping mall. Then from nowhere, we have this patient not knowing that they were epileptic. Okay, they go into an attack, the basket is thrown around, and the patient is on the floor. So in that context, then, what should we do? The one thing that we did was to stabilize the patient even as we arrange for transport. So you need to assess the scene, evaluate the scene of an accident, assess safety. If there are things that you feel may actually bring harm to the patient, you clear them away. You need to prioritize care because that's the first thing that you want to do to this patient. Check for any medical alert tags. There are people that would move with tags on their hands, could be a band, a bangle. Check if they have any information pertaining to their condition. Do head to toe examination, which would be very quick. And then apart from that one, only move when it is necessary. Don't move anyhow. Don't move them if transport to ferry them to the institution has not yet arrived. Now, first aid is actually offered with the use of the acronym ABC. The A stands for airway, the B stands for breathing, and the C stands for circulation. Airway must be open, okay? The air passages, so that air containing oxygen can probably go to the perfuse into the patient's tissues. Then secondly, you need to establish breathing, okay? This becomes so important. If our patient is not able to breathe, then this may just result in poor outcomes. Then they see it's all about circulation. We need to feel the pulse of the patient, and all of us, I think, we have been subjected to this in the skills laboratory. I would say even before you do your blood pressure, all of us, we understand that we need also to check for the pulse. So airway, breathing, and circulation is all about the circulation of blood around the body. Then the other very important issues that we need to fall back on, it has to do with the rules of first aid. Okay, rules of first aid, which will apply to you in this context as a first aider. So we need to reach the accident spot quickly. But of course, if you're at that scene of an accident or scene of this eventuality, then you need to be in a position to act swiftly. Be calm, methodically, and quick. Even as this event is unfolding, you should know what you need to do first, what you need to do second, and so forth. And you need to look for the following. The first one is severe bleeding. Secondly, you need to look for shock, which could be light shock or severe. And then we also need to be in a position to start artificial respiration. Besides this, you need to stop bleeding by ensuring that you arrest bleeding points. Sometimes the arresting of these bleeding points could be just applying so much pressure, or sometimes you're using a bandage to seal off that portion. Then besides that, avoid handling the casualty unnecessarily. Inspect. Let me just do this. I think I need to move from this place a bit. Okay, so we continue we are on the rules of first aid. So we are saying that avoid handling the casualty unnecessarily. Moving the casualty unnecessarily should be avoided at all costs. Then the reason why this is being stressed on, because you end up injuring the patient, and we know that you don't even have the capacity to offer appropriate care, because the patient could be far away from the institutions. Then besides that, you can also inspect the area. I think this already said so. You need to clear the crowd with a nice word, of course, not the weather, or when this eventuality is happening, if it is as it was raining, and maybe the place is soaked. So you need to ensure that the patient is in a dry place, covered, so that they are kept warm throughout. Besides this, you also need to reassure the casualty. One thing that becomes so true is that even though the patient is injured, is in this critical situation, the sense of hearing is still functional. And you need to ensure that the patient is reassured. This part, arrange for this part, and this is now arranging for transport. If not, you need to book a transport that can ferry the patient to the nearest facility. Do not attempt too much, okay? Don't attempt too much. That's why the other point says avoid handling or moving the casualty unnecessarily. What you are simply doing is to stabilize the client, and it ends there. That's why it is being called first aid. What are the contents of a first aid kit? All of us, we need to be oriented, we need to be exposed to the first aid box. So, what are the contents of the first aid kit? The contents of the first aid kit include the cotton wool, adhesive tape, crepe bandage, that's stretchy bandage, then a sterile dressing, the normal bandages, the thermometer, scissors, gloves, and these gloves mainly are clean gloves, soap, small tablet of soap, if possible, ORS, or hand sanitizer, pain reliever, and acid, and so forth. So the contents of the first aid box may vary, but these are things that are so ideal and needs to be found in the first aid box. Then let's focus on things that we can consider as condition that we can institute care for or provide aid, which is initial, before we take them to the institution. The first one is fainting. This is also known as syncope. So fainting is a brief loss of consciousness. And what are the causes of this brief loss of consciousness? Could be head injury. Someone is walking and knowing they knock themselves against the door, and etc. Probably maybe see the sports, they are trying to play football. Okay, so they sustain head injury. It could be a car accident. So head injury, epilepsy. Epilepsy is a condition in which we have disturbed electrical conductivity in the brain, which will result into convulsions or seizures. Then we have stroke or cerebral vascular accident, and this is a situation when we have disruption in the flow of blood to the brain. Poisoning, of course, we know what it is. Diabetes mellitus, especially when diabetes has complicated and it is now referred to as diabetes insipidus. So when it reaches that extent, it may even result into diabetic ketoacidosis, and the patient may just be in this unfortunate condition and they faint. And besides this, any conditions associated with lack of oxygen may result into fainting. What are the do's? What are you supposed to do? If you are in a situation where you are able to have a catch of this person, you can catch them before they fall. Pinch the person and see if he or she is moving and opening their eyes. And this pinching is a gentle pinch using your thumb and your first forefinger. Then examine the injuries and causes of unconsciousness. Tilt the head back and keep arms at right angle to the body. You are trying to raise the legs 8 to 12 inches. Why? You want just to promote good blood flow to the vital organ. And which one is it? The brain. Loosen any tight clothing. This is important so that you do not constrict the flow of blood. Keep the victim warm. The reason why you are keeping the victim warm is because if this patient is exposed to extreme levels of coldness, it will cause vasoconstriction and which may just impair circulation of blood to vital organs. Keep a record of the casualty's condition, even as you are anticipating to move them. The don'ts: don't give the patient anything to drink or eat. It may just choke them, and if the patient would be operated on, it may be a problem. Don't allow the person who has just fainted to get up, because this may lead to hypotension, which may again just be a relapse of the fainting itself. Don't crowd around the victim. Having a lot of people come around the victim, that should be avoided. The patient or the client needs fresh air, enough air. So if we have this crowding, it may prevent quick recovery. If possible, you can administer CPR. Now, administration of CPR is very important. Why is it important? Administration of CPR, by the way, even as you are doing this, lay the person on his or her back. That is important. Then secondly, give chest compressions, tilt the head slightly. Then you breathe into the person's mouth. Continue until medical personnel arrive. But one could be asking, what is CPR? It's one of the first aid techniques, okay? And usually this is done when you notice the heart of this patient is somehow not as effective as it could be. CPR stands for cardiopulmonary resuscitation. It is an important procedure because it can save a life, and also it is buying time before a paramedic team arrives. Now, without CPR, usually brain damage can begin within minutes. Actually, 5 minutes without supply of oxygen to the brain, it may lead to brain damage. Is it 5 minutes? I think it's even too much. So that becomes important. So in simpler terms, you are doing chest compressions, you are pressing hard and fast in the center of the chest to pump blood, okay? Then those rescue breaths that you are giving, breathing into the person's mouth, you are trying to introduce or supply oxygen, okay? Then the other thing that is also important is to take note. This situation is fainting and CPR is needed. And key points to remember: if you are very unsure of doing CPR, don't even start it, because you may just worsen the condition of the patient. Remember, one of the rules of first aid is that do not intervene unnecessarily, and in a situation as you are doing that, the patient condition may just worsen. Okay, that's CPR there. Then the other thing that would prompt us to provide a first aid is when one has choking. All right. Now, choking, of course, may be as a result of a lot of substances going to block the respiratory airway. So in such a case, how then do you help such a client? And maybe even to just define what choking could be. This is when food or any object blocks the airway, stopping air from reaching the lungs, okay? Now, what do you need to do? Ask a person to speak or cough. Now, the reason why you are doing this, it is because as they are doing that, they are also trying to encourage the movement of such a particle upwards. Now, you are not slapping, Okay, do not slap their back if they are coughing very well. It may not just be necessary. But what you need to do is to deliver 5 back blows, gentle ones. Okay, it's not fighting. Then you are performing abdominal thrust. What you're able to see in that picture, it is what is known as the abdominal thrust. It is also called the Heimlich maneuver. Heimlich spelled as Heimlich. Okay, so for adults and children over 1 year, you stand behind the person the way we are seeing in the picture. Then you wrap your arms around their waist, okay, and you make a fist and place it above the umbilicus or the navel. That's where you are placing. Then pull inward and upward sharply. You are repeating this until the object comes out. I think could be yesterday or the other day. On the internet, there was a video of a gentleman who had to perform this procedure on himself. So how did he do it? He went and leaned over a sofa, the raised sofa, and put his diaphragm almost at that point where you're seeing the hand passing. That's where that soft chair would pass through. And he pressed himself against that chair until whatever was in the mouth came out. And the video was recorded because it was under CCTV. So you repeat this sequence of back blows and abdominal thrusts until you see such an object pop out or come out. Okay. The other thing that we need to offer a first aid is in a situation when a patient has what is known as a stitch. Okay, so a stitch is it's also it's a painful spasm of the diaphragm, which it can happen as it has been projected, which can happen during a game or running. I think these are things that those who have experienced prolonged running would definitely tell you. So our meeting is ending in 10 minutes time. Okay, we'll hurry a bit. So what do? You basically give a rest, give sips of hot warm water. Warm water, hot is the same. So sips of hot water rather. Then besides this, you also gently rub the affected area or the abdomen, okay? Just to ensure that the muscles are, in other words, the muscles are relaxed. Then we have cramps. Now, cramps are involuntary contractions of the muscles. Mainly, this may occur if someone is dehydrated, especially when, for example, if the muscle cramps of the calf, the reason why those are coming in is because someone is dehydrated and the muscles have lost, or the body has lost the electrolytes. Okay, the electrolytes have been lost. And which electrolytes are we focusing on? Potassium, calcium, magnesium. So this would come in. And what would really help is gently stretching the muscle, massaging the area, drinking water, if possible, water containing the lost ions, applying warmth to that area. And mainly that what helps very much, it is the resting, unless it is so severe. What could be important now in terms of as providing first aid. It's a situation when we are confronted with bleeding, and bleeding can be as a result of cuts, scrapes, puncture, and so forth. So the only important thing that we need to do is apply pressure and elevation if possible. Bandaging can also be done to consistently apply pressure. And once this has been achieved, you will have a situation where bleeding gently stops. And this becomes so important because if the patient continue bleeding, what would happen? They will definitely go into shock, hypovolemic shock, and death will ensue. Then we have fractures. A fracture is a situation when we have a discontinuity in the lining or in the bone itself. Okay, it's basically a break or crack in the bone. And the common causes we have falls, road traffic accidents, sports injury, direct blows. These may actually result into fractures, and we will understand that fractures could be closed fractures where the bone is broken but the skin is not open. We have open fractures, okay, broken bones will pierce the skin, and we have complete fractures where the bone is broken in two or more parts, okay? So this is usually one of the a thing that may happen even as we are providing care. Then what are we supposed to do? Immediately check the danger, okay? Control severe bleeding if they are bleeding, place sufficient padding to support the fracture site. So all in all, what is critical in a situation when there's a fracture is immobilization. Make sure that the fractured ends are not moving, because if they are not immobilized, they will end up injuring the surrounding tissues. So do not force bones back into the wound. Okay, give proper padding before the patient is shifted or taken to the hospital. Apply ice packs if you have. These will just try to reduce on the pain and treat, if possible, shock if it's available. The other emergence that may arise is when an individual has a dislocation. Just a week, we have a builder who fall from a 4-meter scaffold. They were skimming a house. So unfortunately, when they were falling, they landed on the right leg. So the whole weight of the body went on the right leg, and on the knee, the tendon, the ligament C, they are damaged, and this upper part of the leg was even going into a position, no fracture, but torn tendons. Okay, so now a dislocation is when the bones have come out of a joint, in simpler terms. And usually this would be noticed on the shoulders, the elbow, the thumb fingers, and the lower jaw. This would be presented with pain at the site of injury, limited movement, deformity, swelling, tenderness. And what then do you do? Again, immobilization can work very well. If you think there is no fracture, you may try to pull and put the bone in the socket or in the joint, a very, very painful procedure. But if you are not able, please do not even attempt anything, because you end up injuring this patient. We have the other one, which has to do with strains. Now, a strain is an injury to a muscle in which the muscle fibers tear as a result of overstretching. And one thing that we'll notice to say there is a strain, there'll be stiffness, inflammation, bruising, localized pain. Okay? Then besides this, we also have, let me just check. So we also, that we have sprains. A sprain usually would occur at a joint where there's tearing or overstretching of the ligaments or tissues. Loss of function to that portion of the body would be noticed, and because of that, the only thing that we need to do again is immobilization. I think there should be a comment somewhere from the owner. Can anyone hear? I can't. Are we able to hear me? Am I audible?
Yes, sir.
Yes, you're
Yes,
loud
sir.
and clear.
Audibility?
You are very audible.
Thank you. So treatment of sprains and strains, usually we need to use this acronym PRICE, P-R-I-C-E. One, protect, immobilize, okay, resting, that's mobilization, of course. Then you can put ice compress. Then compression, elevation becomes important. The reason why we are doing this, we are putting on ice just to prevent so much pain. Elevation, of course, we don't want it to swell so much. Okay, so when a sprained ankle occurs outdoors, do not remove the shoe. Why is that important? The shoe is also acting as a pad, like a material that we can use to immobilize the portion. The meeting is ending in a second, so we will be sharing a link immediately it drops. So dehydration. Dehydration means loss of salt or electrolytes in short. And one thing that would help us to avoid this dehydration is replacement. And how do we replace it? We use ORS, oral rehydration of salts. And if you don't have the one that could be bought from a farmer's outlet, you can use salt